Hi, welcome to the Salt Health Podcast. I'm here with Dr. Aunna Herbst today to talk about a really hot topic, infertility. And it is a very delicate topic and near and dear to a lot of our hearts. And so I wanted to bring you on today and talk about some of the breakthroughs you've been having and your wisdom and your knowledge. I'm excited to get to be here with you today.
Thank you. Thank you. It's an important topic. I like how you said it's a sensitive topic. I think with statistics saying about 20% of the world population dealing with infertility, it's a big deal. 1 in 6 now. It was 1 in 200 back in the 80s. So it's definitely changed.
1 in 6 couples or
1 in 6 people affected by infertility over their lifetime. So that's a big change. And I think our approach to infertility has changed, but it hasn't changed as much as I feel like the information has changed. So I think there's a lot more that we could be doing. I think our approach could be a little bit more root cause and looking at it from different angles, and we'd have better outcomes. So I think that's what we're going to talk about today.
I love it. So let's go ahead and dive in about why this topic is even important in trying to conceive, in trying to conceive, and then also once you conceive, making sure you have a healthy and successful pregnancy, and then post. So talk about how functional medicine is integrated, that's how you got started, of course, first.
Yeah, of course. So functional medicine just looks more at root cause. So it's going to ask the question, why is the couple not able to either get pregnant, or they maybe want to get pregnant but want to be preventive in their pregnancy and as healthy as they can be. And I say they because, remember, fertility affects both male and female. And actually, statistically, it's pretty equal. 30% or so, 30 to 40% of the cases are a male causative agent or causative problem, and some 30 to 40% could be female. And then the other part, the 20 to 30% that's left over, is actually a mix or an unknown reason. And so that leads us to the functional medicine part. The reason that they're not getting pregnant, or the reason they're not holding to a viable pregnancy and having a full-term healthy baby. You want to look at root cause. You want to ask the question, why? Why are they not? Why are they not able to conceive? Why are they not able to hold it? What are the reasons? And I think that medicine's done a really pretty good job asking those questions, but it's sort of become stagnant in the last probably 10, 15 years. We haven't kind of moved forward. It's usually go do IVF or do fertility treatment or manipulate the hormones some, or maybe we put you on a baby aspirin, which is a big step because we'll talk about that in a minute. But they realize that sometimes clotting disorders can affect a full-term pregnancy, or, miscarriages and so forth. And so anyway, I think that we have changed our approach. Before it was just like, oh, well, sorry, you had another miscarriage. Oh, sorry, sorry. And that's really hard on the family. It's hard on the patients, the females. It's hard on the couple. It's hard on the relationship. It's incredibly expensive to go through fertility treatments. It's really trying and taxing emotionally and physically on the body. So I think there's a lot that comes into play. And so the functional medicine approach looks at root cause. So you can start preconception and you say, I've got a family history of X, Y, and Z, or I have a personal history of some health challenges. How can I get my body in the best shape it can be so that I can have a healthy pregnancy for myself and for the baby? So the foundation and the terrain for the baby, the environment, the housing unit for the baby is healthy as it can be. So we look at root cause, toxicity challenges, gut health, the whole 9 yards. So that would be a functional medicine approach, optimal nutrition, all of those things. And then take it a next step further. If we're not able to conceive, I'm healthy, but for some reason I just can't keep a pregnancy, or I'm miscarrying early or later term, why? What's the question? Most people that get to a functional medicine approach, they've already had a basic workup. They've been to the, specialist. They've gone from their OBGYN to the specialist, and they've done a workup for, blood clotting disorders and a few other things. And a lot of times they'll say that 20 to 30% are unexplained. I don't know. I'm not sure. Next time maybe we'll try this. Keep trying. And so that's the group that usually comes to the functional medicine world and says, something's got to give. Like, what else could it be?
Yeah, just because it's common doesn't mean it's any less
Right.
outrageous.
Yes, exactly. So it's very, very challenging. So our approach looks at, the health of the mother, health of the father, nutritional status, toxicity status, changed lifestyle, optimized glucose and insulin. Like there's a lot of parts to it. But one of the biggest areas that we've grown in is the genomic part. And I'm hoping that we get to broach that today. So
Yes. All right. So for us lay people, what is genomics and how is that different from DNA?
yeah, perfect. So genetics are what we're born with. They are our genes. So you have blue eyes, I have brown eyes. That's not going to change. No matter how much I change my diet, my eyes are going to stay brown. I tried, didn't change. So that's genetic. Those are usually deletions or insertions when someone has something genetically challenging with their phenotype or the way they look. It's because it's a permanent change in the DNA. Genomics is your DNA and how it reacts to the environment, how it reacts to stress, how it reacts to nutrition. So it can be changed. So genomics has to do with more of the metabolic processes that make our body work, the way they work. And so you can take things out of your environment and change the way your genomics work. You can add things in to make them work differently or optimize them. And so that's where genomics plays a huge role now in fertility and infertility. So fertility and infertility.
So which genomics test do you use and how did you choose it?
Yeah, so that's actually a really good question. There are a lot of genomic tests on the market. There's several, and I'm going to actually use my notes because I want to make sure I use the right verbiage. There's a direct-to-consumer type of genetic or genomic testing, very popular ones, very inexpensive.
Like the ones you get in the kit?
Yeah, you can buy in the kit, grocery store, or Walmart, Target, whatever. And those are nifty and cool for like trait facts, like you have prone to red hair, or you have some genetic ancestry that's more, Scandinavian. That's what that's really going to do. That is not the testing that they use is called microarray. So one, it's pretty outdated. Two, it's not going to give you, it's very limited in the amount of information it can give you as far as like metabolic processes and so forth. And it's definitely not clinically validated anymore. So that's the challenge with that, but very inexpensive. Kind of neat to learn about genetic type family history stuff.
What about the ones we find online?
Yep. So then you get a little bit more, there's online ones that are definitely more genomic information, but they're algorithm based. And so they take the raw data, a bunch of numbers and letters, and then they spit out an algorithm, use an algorithm, they spit out information that says, hey, here's some clinical insights, but it's very generic. It's not tailored to you. There's a lot of different subtypes that they're not reporting. So it's not as clinically relevant.
And it's only based up on the data that they have in their system.
Absolutely.
Is that what I'm understanding?
Yeah, absolutely.
So it's only being compared to whatever participants participated in that particular
Correct.
system.
Correct.
Okay.
That's my understanding of that one. And so there's a few out there. So that's the next level up from the store ones that you can get or whatever. And they're a little bit more expensive. But again, no clinical support and very clinically limited. Then you have a next level up, and that's where the favorite of mine is that falls into this category. So that's going to be more of the better, newer testing, number one, more variants tested, and clinically relevant and medical decision-making information that comes from it. So you can actually take information that I get from your genomic patterns, and I can say, based on category A and B literature, these are some suggested clinical outcome tools that can improve outcomes. And so it's tailored to you, number one. Number two, it helps with medical decision-making. Not many on the market.
Wow.
Yeah. So the one that we use that's why I use them, because it's and then privacy is my other big one. And that's their big go-to. Am I allowed to say who I use?
Oh, yeah, please.
Okay. I prefer Intellect's DNA. I have tried many companies, and I find that
We're not affiliated with them.
No. Nope. Great people. I have learned all about their processes and their research team and all of that business, and that's why I go to them. They only use integrative and medical literature. They use it from all over the world. It's not limited to just the States, which is, I think, fabulous. And it's all what we call in research the top 2-tier literature, so category A, category B. So I find that to be really powerful. So that helps me make some of my decisions when I'm making plans for fish.
Talked about Intellect's DNA in other podcasts. And so if anybody's interested, you definitely need to dive into those podcasts. But today, I really want to talk about how you've been talking about how it can help with fertility and how it can just change the landscape with a couple that might be struggling.
Absolutely. So the famous MTHFR that's out there. So that was something that they actually started talking about probably, I'm trying to remember the first time I actually addressed methyl tetrahydrofolate. So it has to do with the pathway, enzymatic pathway, where it converts a vitamin B9, folic acid to folate to methylfolate and so forth. It's an important pathway, don't get me wrong, but it was kind of one of the first buzzwords in the genomic world. And I think I started addressing that in 2011. So it's been a long time. And in the DNA world, that's old. That's old news, right? So fast forward, it is still important. It is definitely one of them that plays a role in things like preventing spina bifida, for instance. It's why we have folate in our prenatal vitamins. Super important. But it is only one part of that whole methyl pathway. So it's only one part of the picture.
So what categories within the Intellect's DNA report are helpful for infertility and fertility in general?
Yeah. So they actually now have a fertility panel. Oh, wow. So it's specific whole section just to that, which is amazing. They also have a hormone section, like in the PCOS section. So when you have imbalanced hormones, you might have other problems besides fertility issues. So they also have those panels as well. But then, of course, they have like the brain health, and they've got, cardiovascular stuff. They've got your vitamin panels and inflammation, which is important when it comes to fertility as well. So how about I give you some ideas or some examples? Because this is where the new stuff is, and I'm so excited to talk about it. It's new to me as well. I'm still learning. But when you get some of those cases of fertility where you try the progesterone, you try the hormone balancing, you detox them, you help clean up the diet, you keep their insulin really tightly controlled, and they're still not able to conceive or something's still off, it's heartbreaking. They've worked really hard. And so this next bit of information takes that game up 10 notches. And I am so excited. It is really new. So this is me learning alongside the patients. I always say you're at the mercy of my learning curve. So
that's the great part about functional medicine, though.
True. No, true. You always keep learning. So anyway, good example, case study, 3 miscarriage history, originally found to have low progesterone. Functional doctors said, okay, put them on progesterone, which is a super great idea. Did that, conceived, but then miscarried about 18 weeks. So it was after they checked her and blah, blah, 18 weeks in. So miscarried. Had a second pregnancy, very similar. Did a full, now she goes off to the specialist, this is your second miscarriage. So full post-natal workup, normal, no answers. So they send her off to maternal fetal doctor, a specialist, another specialist, and they say, well, let's do some clotting workup and see if maybe it's because you have trouble with blood clotting or something like that. Everything was normal. It was really, really disappointing. They even checked some immune markers, all normal, because sometimes the body attacks, placenta and things aren't right. And so, nope, he said, well, we'll just put you on aspirin. Maybe that'll help if there is some sort of unknown clotting disorder. Again, pregnant, miscarried. He said, next time, of course, this is tough to hear the next time, right? Yes. Next time, because it's probable clotting issues is noted in the note, unexplained, we'll try Lovenox, which is a type of anticoagulant injection that you would do. Wow. And so she was like, okay, so here we are. She heard about the genomic testing that was just coming out. And so she does this test. She gets the information back and finds out a couple of things, really profound things. One, she has something that has to do with the placenta not quite developing properly. But the cool part is that alone not fixed or not manipulated by what the body needs, can cause small restriction of the growth of the baby. Okay, so there's one part that can cause some problems. But just adding creatine pre-pregnancy, getting her creatine or protein levels up adequately can help. And as soon as she was pregnant, they had to switch her to a food source, but she had to have adequate protein, but not too much, because this affects this SNP, this gene variant. We call them SNP, single nucleotide polymorphism, this little tweak in the DNA, basically is what that means. So she had that one. She had another one that had to do with ability to make glutathione. It's really important because that increases recurrent pregnancy loss. It's documented. We know that. And one of the most easy things she could take all through pregnancy was something called sulforaphanes, which is made from 3-day-old broccoli sprouts. Amazing, right? So she's taking something that's a food supplement that's going to help, in this case, decrease her recurrent pregnancy chance. Okay, so now we've done two things we've identified. The one above was the creatine, and zinc and mag also help that first one. So she's going to add some zinc and a little bit of magnesium into her diet.
And these are all things they found when she did the Intellect.
Yeah, this is all from the genomic testing from Intellect. The second big one was this HLA-G, but long words, it doesn't matter. The point is it causes vascular remodeling. Very, very important. It causes the spiral arteries around the uterus to be funny, basically, so you don't get proper blood flow. Increases that risk of fetal growth restriction. So again, baby can't grow, get started, not get enough blood supply, not doing things right, done. So the treatment for that is progesterone, but it's 100 milligrams twice a day, and the use of what they call physiologic steroids. So they have to send her to a reproductive endocrinologist to follow. And so they added the hydrocortisone, which is a very low dose physiologic steroid. And they gave her the progesterone, but progesterone at the right dose, not that low dose she was on before. And she had a successful pregnancy.
Wow.
Yeah, that makes me cry. So she is just delivered, and this was not my case. It was a case that was presented, because this is all new, by the way. But this is baby number, 5, attempt 5, and now just delivered. So
and a healthy
really super cool.
Baby and pregnancy, and it wasn't just one thing.
No, it was actually several, and it was really cool because the doctor said they all worked together, which was really nice because the specialist, her GYN, and this person that was doing her intellects, the genomic testing, they all worked together, and they said, okay, we're going to stay on the aspirin. That was good. We're not going to use Lovenox. It's not appropriate. Don't need it. We're going to do these other few things, and we're going to see what happens. And sure enough,
the definition of personalized medicine.
Absolutely.
Really is
and a team, right? Like a full
team approach with the personalized medicine. It's I don't see how medicine isn't totally going this direction.
I think it's slowly evolving there, like the more we learn, but it takes a lot. I mean, I feel like the more I learn, the less I know. And so it's hard. You have to do way more education. It's time consuming.
You're constantly going to conferences.
Oh, yeah, for sure.
Doing online courses.
Yeah, absolutely.
And meeting things, because just to stay on top of it. That is so exciting. I love that.
Yeah, so I thought I'd give you an example. There's a lot more, they can look at and identify. I think they're going to really change this world soon.
Well, so tell me about in that process, and even if you were to treat a patient, do you address both the father and the mother?
Absolutely. So always do that.
How that works in conjunction, because obviously that story was about a mother.
Yep. So that's with the female side. Now, if it was a male, this is a good example. So for men or males, a lot of times sperm motility, sperm shape, the viscosity of the liquid that the sperm travels through all affects the outcome, right? So you want all of that to be healthy. And so there are things you can do to test and look at nutrient-wise, toxicity-wise. One of the big things, for example, for motility, if they have genomic variants that interfere with glutathione production, it can decrease swimming ability. So that's a big deal. If they have trouble with zinc conversion or transportation or uptake or absorption, and they don't have enough adequate zinc available to them in the cell, we know that plays a role with testosterone. It plays a role with the ability of the sperm to develop properly. So it plays a big role. So there's actually a lot of things we can look for the men as well. Optimizing their testosterone, but not overshooting it, important. There's a lot of things. Glucose regulation.
So a couple comes in, they have been struggling with infertility. Where do you start? Do you start with the mother, or do you start doing, would you suggest starting testing both?
Absolutely. So one of the biggest struggles with, I think, emotionally with the couple is that we tend to automatically start the workup on the female. And I don't know how many miscarriages or months go by and she's doing all the workup and we haven't even addressed possible issues or optimal health with the male. So I start them both at the same time, and I would recommend anybody start at the same time. Make sure you check the sperm. What's it look like? Look at his health. Look at his glucose levels. Look at his insulin levels. Look at his detox capacity. Does he have good gut health? That plays a role too. So, make sure we optimize dad and we optimize mom and really start the workup together so that you're not, 9 months down the road, haven't even looked at dad yet.
Sure.
So I think that probably both would be my suggestion.
Absolutely.
Plus, it's a together journey, right? Isn't it?
For sure.
Yeah.
For sure. It's one doesn't carry the load over the other.
Right. I think it brings them together on that.
So one of the things I know that you have mentioned is preparing your body before conception. Do you have any thoughts around that, about how the genomics profile can help with that?
Yeah, absolutely. So preparing before, you're going to look at things like, besides gut health, if we're talking genomics, it would be detoxification. It would be, how do I process and regulate my hormones? Do I convert testosterone into estrogen or not? Do I have trouble with, B vitamin conversion, like the folate we just talked about, or B12 transportation? Am I going to have trouble with, inflammation? There's a couple of inflammatory markers that if they have them and they're abnormal or they don't work correctly, the body will attack the placenta because it thinks it's a foreign, substance or a foreign invader. And so that's a inflammatory marker, inflammatory SNP genetic variant that we can test that is tested on the fertility panel. And so I think looking at it ahead and saying, oh, I'm prone to having X, Y, and Z. How do I manipulate that? How do I dampen down the weirdness of that, activity of that one? Or how do I upregulate it because it's not working right? And so I think the more you know ahead, the better foundation and terrain you have going in.
So talk to me a little bit about how having the genetic knowledge can help reduce anxiety.
Well, okay. So a lot of people actually say, I don't really want to know because I'm afraid to know. That's like the old, that's more, to me, that would be someone that's testing genetic things. So like your breast cancer risk, your BRCA testing, if I know that I am BRCA positive, then my risk for breast cancer goes up. And then I'm worried a little bit about that, right? But for me, it's empowering. Even that would be empowering because I would say, well, what I'm going to do to prevent it? Like, what do I have to do? And then I do my genomics and find out I need to stay away from pesticides and insecticides. I need to help with my detox markers. I need to make sure that I'm dampening down certain inflammatory pathways. And so the genetic testing and then the genomic testing, to me, are empowering in the sense that you can take action. You can say, here are my risks. They may never come to play, especially if I manipulate my lifestyle to keep, things from showing up or turning on, so to speak. So I think it's more empowering than anxiety provoking in my mind.
And I think having a personalized, your genomics, your partner's genomics roadmap with the most cutting edge technology that we have available right now.
Yeah.
It gives a sense of empowerment to the couple of, okay, these are some of the next steps we can take. It's not just this shoot in the dark, one heartbreak after another.
Right. Well, I mean, there's even
people struggle with.
Yeah. For example, we don't have as we've spoken of before, but we don't have one genetic challenge or DNA SNP or variant that is specific to, say, autism or neurodivergent presentation, but we have a pattern of several that could increase a person's risk for, portraying or presenting with some neurodivergence. Okay, well, if I know I have 6 things that I could do something about ahead of time to help my child maybe not have more severe outcome or a more negative outcome, then I would be very empowered and very motivated to do the things I needed to do from a lifestyle standpoint to dampen down that risk. So that to me also empowering and shouldn't be anxiety provoking. Sure, it might rattle you a little bit. It's a little humbling to find out information about yourself, but I think the more we know, the better choices we make.
Sure. And it can help you seek out another tool.
Absolutely. Or a specialist or whatever is needed.
That's right.
Yeah.
So,
yeah.
Well, do you have any final thoughts or encouragement to couples who might be struggling or interested in this?
I think it's an investment. It's an investment in the family. It's an investment in yourself personally. But it's an investment that could be incredibly empowering for generations. So I don't really have any further advice, but I think it's just a tool that is available, that is new, and I wanted to get it out there and tell people about it.
Yeah.
Yeah.
Just another source of hope and encouragement.
Absolutely.
Well, if you'd like more information about doing an Intellect's DNA test with Dr. Herbst and the Salt Health team, or doing a functional medicine workup with the Salt Health team, we have all of that information on our website. You're welcome to check it out. Thank you, Dr. Herbst, for being with us today, and we appreciate you and all you're doing for all of us patients.
Thanks. I appreciate it. Bye-bye.